passing of a 73-year-old man. 4 sleep habits to avoid after age 70. Have you ever woken up feeling fine, only to realize something unexpected is happening within your body? Yesterday might have been unremarkable, but today is unforgettable. A seemingly healthy 73-year-old man passed away peacefully in his sleep, without warning. The question is, could this have been prevented? Especially after 70, seemingly harmless daily habits can have unforeseen consequences. In today's video, we'll explore 4 pre-sleep habits older adults should avoid to protect their health and enhance their quality of life. 1. Consume your meal before bedtime. Impact on the digestive system. Mechanism. During sleep, the body focuses on restoration and rest. However, if the stomach is still digesting food, it must overwork, disrupting sleep. Undigested food can put pressure on the lower esophageal sphincter, LS, potentially leading to gastroesophageal reflux disease, GERD. Consequences. Acid reflux. Lying down immediately after eating can cause stomach acid to reflux into the esophagus, leading to heartburn, discomfort, coughing, or even shortness of breath. Bloating and indigestion. Digestion slows down at night, causing food to remain in the stomach longer, leading to bloating, discomfort, and impacting sleep quality. Increased risk of gastritis. Regularly eating late can cause the stomach to secrete more acid at night, potentially damaging the stomach lining. Cardiovascular and blood pressure effects. Mechanism. Eating large meals increases the workload on the heart, as it needs to pump more blood to support digestion. Foods high in fat or salt can elevate blood pressure and strain the heart. Older individuals may experience an increased risk of heart rhythm disturbances, high blood pressure, or even stroke during sleep. Consequences. Increased blood pressure. Late-night eating can raise blood pressure overnight, particularly in individuals with a history of hypertension. Irregular heartbeat. The body requires time to lower the heart rate before sleep. However, overeating can maintain a high heart rate, leading to sleep disturbances and an increased risk of heart attack. Stroke risk. Some studies suggest that eating close to bedtime may increase the risk of stroke due to sudden fluctuations in blood pressure and blood sugar levels. Impact on blood sugar and metabolism. Mechanism of action. When we eat, particularly foods rich in carbohydrates, starches, and sugars, blood sugar levels rise. The body releases insulin to regulate blood sugar. However, this process can be disrupted at night, leading to blood sugar imbalances. Consequences. Increased risk of diabetes. Late-night eating and overeating reduce insulin sensitivity, potentially causing blood sugar dysregulation and increasing the risk of type 2 diabetes. Nocturnal hypoglycemia. In some individuals, particularly those with diabetes, insulin can lower blood sugar excessively at night, leading to fatigue, cold sweats, or dizziness upon waking. Impact on sleep mechanism. Ongoing digestion prevents the body from achieving deep relaxation, reducing sleep quality. Certain foods containing caffeine or spicy ingredients may stimulate the nervous system, leading to insomnia. Consequences. Difficulty falling asleep. A full stomach can cause discomfort, heartburn, or feelings of fullness that interfere with sleep. Restless sleep. Digestive activity may cause frequent awakenings throughout the night, disrupting sleep. Fatigue the following morning. Insufficient or poor quality sleep can lead to fatigue, headaches, and a lack of alertness the next day. Healthy eating habits and solutions before bedtime. Optimal timing. Finish your dinner at least 3 to 4 hours before bedtime to allow your digestive system sufficient time to process food. If you need a light snack, opt for easily digestible foods such as warm milk, almonds, bananas, or herbal tea instead of greasy or sugary foods. Healthy food choices include lean protein, chicken breast, fish, unsweetened yogurt, green vegetables and fiber, spinach, broccoli, carrots. Healthy fats, almonds, walnuts, olive oil. Avoid high-fat foods, fried foods, fatty red meat. Stimulants, coffee, alcohol, strong green tea. Spicy foods, pepper, chili, garlic, hot sauces. Maintain a regular eating pattern. Eat regular meals throughout the day, avoiding skipping meals and overcompensating in the evening. Reduce your evening portion size, prioritizing breakfast and lunch. 2. Sleeping in an overly warm room. Difficulty regulating body temperature. As we age, our bodies become less efficient at regulating temperature. Reduced sweat production makes it harder to cool down, especially in warm environments. Sleep requires a drop in body temperature to reach deep sleep stages, crucial for health, repair, and cellular renewal. However, excessive warmth hinders this cooling process. Consequences: difficulty falling asleep and maintaining restful sleep. Insufficient temperature reduction leads to light, restless sleep and inadequate recovery. Reduced sleep quality. Studies show that sleeping in warm environments prevents the attainment of deep sleep stages, REM and slow-wave sleep, resulting in daytime fatigue and lethargy in older adults. Elevated temperatures increase the risk of cardiovascular diseases. High room temperatures force the body to work harder to regulate its temperature, placing additional strain on the cardiovascular system. To compensate, the heart beats faster and pumps blood more forcefully, potentially leading to increased blood pressure and a heightened risk of stroke or other cardiovascular problems. This increased workload can result in hypertension, placing significant stress on the heart. The strain on the cardiovascular system is particularly concerning for individuals with pre-existing heart conditions or hypertension, and the risk is amplified in older adults whose hearts may be less resilient. The risk of dehydration and electrolyte imbalance in older adults stems from the body's natural cooling mechanism, sweating. While sweating is crucial for thermoregulation in warm environments, older adults often experience less efficient sweating compared to younger individuals. This reduced sweating capacity, coupled with insufficient fluid intake to compensate for fluid loss through perspiration, significantly increases the risk of dehydration and subsequent electrolyte imbalances. Dehydration poses a particular threat to older adults due to a diminished thirst sensation. This means they may not recognize or respond appropriately to their body's need for hydration. The consequences of dehydration can range from mild symptoms like fatigue, headache, and dizziness to more severe complications, including impaired kidney and heart function. Prolonged dehydration can lead to a critical decline in overall health and well-being. Furthermore, dehydration frequently results in electrolyte imbalances. Electrolytes, such as sodium, potassium, and chloride, are essential for proper bodily function. Their depletion, caused by significant fluid loss, disrupts the delicate balance necessary for optimal organ performance. This imbalance can negatively impact the heart, brain, and kidneys, potentially leading to serious health issues. Therefore, maintaining adequate hydration is paramount for preventing these potentially life-threatening complications in older adults. Regular fluid intake, coupled with awareness of potential dehydration symptoms, is crucial for safeguarding their health and well-being. High temperatures can negatively impact respiratory health. Overly warm indoor environments can lead to stuffy air, making breathing difficult, especially for the elderly or individuals with pre-existing lung or cardiovascular conditions. In hot conditions, oxygen levels decrease, requiring the body to work harder to breathe, resulting in feelings of breathlessness and discomfort. This can manifest as difficulty breathing, particularly at night during periods of rest due to reduced oxygen levels. For those with respiratory illnesses such as COPD, high temperatures can exacerbate symptoms, potentially leading to more severe breathing problems. Ideal room temperature for sleep. Maintaining a comfortable sleep environment is crucial for a restful night's sleep. An ideal bedroom temperature ranges from 61 degrees Fahrenheit to 68 degrees Fahrenheit, 16 to 20 degrees Celsius. This temperature allows your body to naturally regulate its temperature, promoting deeper sleep and reducing strain on your cardiovascular and respiratory systems. To achieve this, consider using a fan or air conditioner to improve air circulation and lower the room temperature if necessary. Opt for breathable sleepwear made from cotton or other moisture-wicking fabrics. Lightweight, breathable blankets are also preferable to heavier ones, allowing for better heat dissipation. 3. Consuming excessive water before bedtime. Disrupting sleep and interrupting rest. Mechanism. When seniors drink excessive fluids before bed, their bodies must process this excess throughout the night. This necessitates frequent nighttime awakenings to urinate. These interruptions prevent deep, restorative sleep. Consequences: disrupted sleep. Each awakening reduces sleep quality. Restless, shallow sleep, lacking crucial deep REM phases, leaves the body unrefreshed. Morning fatigue. Continual sleep disruption leads to fatigue, low energy, and reduced alertness in the morning. Increased risk of falls and accidents. Mechanism. Frequent nighttime awakenings to urinate can disrupt balance and motor control, especially without sufficient time to adjust blood pressure after standing. The cardiovascular and musculoskeletal systems of older adults are less responsive and robust, increasing susceptibility to dizziness and lightheadedness during nighttime movement. Consequences: higher fall risk. Older adults may experience dizziness or loss of balance when rising from bed to use the restroom at night, leading to falls. Falls can cause serious injuries, such as fractures, head trauma, or other wounds. Bathroom accidents. Navigating in darkness or a semi-conscious state at night increases the risk of unexpected accidents in the bathroom, potentially resulting in severe injuries. Impact on blood pressure and cardiovascular health. Mechanism: consuming excessive water at night may require the body to adjust blood flow and fluid balance, potentially stressing the cardiovascular system. Frequent nighttime awakenings to urinate can also prevent blood pressure from stabilizing during postural changes from lying down to standing. Consequences: postural hypotension. Upon rising from bed and urinating, older adults may experience a sudden drop in blood pressure, leading to dizziness, lightheadedness, or even fainting. This is a common concern in older individuals and can result in serious incidents. Increased risk of cardiovascular problems. Nighttime fluid regulation can increase the workload on the heart, particularly for those with pre-existing heart conditions or hypertension. This may contribute to a heightened risk of cardiovascular diseases and circulatory problems. Increased risk of bladder-related sleep disturbances. The mechanism involves excessive fluid intake before sleep. This leads to increased urinary production, as the kidneys filter and process the excess fluid, resulting in bladder distension. During nighttime rest, a full bladder can trigger awakening, particularly in older adults. The sensation of urgency associated with a full bladder compels individuals to interrupt their sleep cycle to avoid consequences. Nocturia and its impact on sleep quality. Nocturia, the need to urinate frequently at night, is a common consequence of this process and significantly impacts sleep quality in older adults. This frequent awakening prevents the attainment of restorative, uninterrupted sleep, leading to daytime fatigue and reduced overall well-being. Long-term health implications of disrupted sleep. Chronic sleep disruption due to nocturia has profound implications for the long-term health of older adults. The immune system is weakened, increasing susceptibility to infections and illnesses. Furthermore, there's a heightened risk of cardiovascular complications, as sleep deprivation contributes to elevated blood pressure and increased stress on the cardiovascular system. The overall quality of life is diminished, impacting physical and cognitive function, social interactions, and emotional well-being. Addressing nocturia and improving sleep hygiene are crucial for maintaining the health and well-being of older adults. Strategies and habits for managing fluid intake before bedtime. Limiting fluids before sleep. To minimize nighttime urination, seniors should limit their water intake 2 to 3 hours before bedtime. This allows the bladder time to process fluids and reduces the urge to urinate at night. Distributing fluid intake throughout the day. Instead of consuming large quantities of water in the evening, seniors should spread their daily fluid intake throughout the day, particularly in the morning and afternoon. This helps maintain adequate hydration without overwhelming the system at night. Avoiding stimulants. Before bed, in addition to reducing fluid intake, seniors should avoid caffeinated or stimulating beverages in the afternoon and evening, as these can increase urine production and disrupt sleep. Before, improper sleeping posture. Sleep position impacts breathing and circulation. Mechanism. Improper sleeping positions, especially sleeping on the back, can put pressure on the respiratory system. Specifically, gravity causes the tongue and soft tissues in the throat to collapse when sleeping supine, obstructing the airway. This can lead to sleep apnea, reducing blood oxygen levels. Older adults may find it harder to maintain a stable airway during sleep due to less flexible throat and diaphragm muscles. Consequences. Sleep apnea is a serious condition, particularly for seniors, where breathing temporarily stops for extended periods during sleep. It can decrease blood oxygen levels, increasing the risk of cardiovascular disease, high blood pressure, and stroke. Sleep quality suffers as apnea prevents deep, restorative sleep, leading to insufficient rest and morning fatigue. Sleep position and cardiovascular health. Mechanism. Incorrect sleeping positions can put pressure on the cardiovascular system. For example, sleeping on your right side can cause gravity to put pressure on the heart, reducing blood flow. This may increase the risk of heart problems, especially for those with pre-existing cardiovascular conditions. Sleeping on your back can also put pressure on major blood vessels and veins, affecting blood flow to vital organs. Consequences. Increased risk of heart disease. Poor sleeping posture may increase the risk of cardiovascular disease, high blood pressure, and circulatory problems. For instance, sleeping on the right side may increase pressure on the heart, while sleeping on the back may reduce blood flow to the heart. Increased risk of heart failure. For individuals with a history of heart disease, incorrect sleeping positions may increase the risk of heart failure and circulatory problems. Compromised blood flow and reduced circulation are potential consequences of improper sleeping positions. The mechanism involves physical compression of blood vessels. When sleeping on one side for extended periods, the pressure exerted on limbs can obstruct blood flow, particularly in the extremities, arms and legs. This compression of veins and arteries restricts circulation, increasing the risk of vascular complications such as thrombosis and other circulatory problems. Consequences can manifest as circulatory issues. Poor sleeping posture can compress major blood vessels, reducing blood flow to vital organs like the heart, brain, and kidneys. This can lead to numbness, discomfort, or pain in the limbs. Furthermore, inadequate circulation significantly elevates the risk of blood clot formation, thrombosis, especially in older individuals who are already predisposed to this condition. Such clots can lead to stroke or serious cardiovascular events. Therefore, maintaining a healthy sleeping posture is crucial for promoting optimal blood flow and minimizing the risk of these potentially severe health problems. Consider consulting a healthcare professional for advice on improving your sleep posture and addressing any concerns about circulation. Sleep posture, muscle, and joint relaxation. A comprehensive overview. Mechanism of action. Adopting incorrect sleeping positions can introduce unnecessary strain on muscles and joints. For instance, sleeping supine without adequate pillow support can lead to tension in the neck and back muscles. Prolonged sleeping on one side can exert undue pressure on the hip and knee joints. Poor sleeping postures can also contribute to spinal misalignment and exacerbate back pain, particularly in older adults. This is because the spine, a complex structure of vertebrae, ligaments, and muscles, is particularly vulnerable to the cumulative effects of poor posture over time. The natural curves of the spine can be compromised, leading to discomfort and potential long-term issues. Consequences: musculoskeletal pain and reduced mobility. Uncomfortable sleeping positions can contribute to various musculoskeletal problems, most notably back pain, neck pain, and joint pain. This can significantly diminish quality of life and impede mobility, making everyday tasks more challenging. The persistent discomfort can also disrupt sleep patterns, creating a vicious cycle of pain and sleep deprivation. Limitations in flexibility and range of motion. When muscles and joints are not properly relaxed during sleep, the body's flexibility and range of motion can gradually deteriorate. This reduced mobility can manifest in stiffness, limited movement, and an increased risk of injury during daily activities. Maintaining proper alignment during sleep is crucial for preserving joint health and preventing the development of chronic musculoskeletal issues. The body requires adequate rest and proper alignment to repair and rejuvenate itself, and sleep is a critical component of this process. Therefore, choosing a supportive mattress and pillow and adopting a sleep posture that promotes spinal alignment are essential for maintaining musculoskeletal health and overall well-being. The optimal sleep position for seniors prioritizes comfort and health. Sleeping on the left side is generally recommended for older adults. This position promotes healthy blood circulation, reducing strain on the heart and supporting digestive function. Furthermore, a left-sided sleeping position can alleviate symptoms associated with gastroesophageal reflux disease, GERD, and acid reflux. To maximize comfort and support spinal alignment, seniors should utilize supportive pillows. These pillows should provide adequate support for the neck and back, thereby mitigating back and neck pain. When sleeping on the side, Placing a pillow between the knees helps maintain spinal alignment and reduces pressure points on the hips and joints, contributing to a more restful sleep. Conversely, sleeping on the back or right side should be minimized. Sleeping on the back increases the risk of sleep apnea, a condition that disrupts breathing and negatively impacts blood circulation. Similarly, sleeping on the right side can exert undue pressure on the heart, potentially exacerbating existing cardiovascular conditions. Therefore, while individual preferences vary, prioritizing a left-sided sleeping position with adequate support is generally advisable for promoting better sleep quality and overall well-being in older adults. So, have you identified any of these habits in yourself? A small change in your daily sleep routine can bring significant health benefits. Starting today, try incorporating one of these adjustments to improve your sleep and protect your well-being. If you found this video helpful, please like, subscribe, and share to support our community health initiative. Leave a comment and share your experiences. We are always listening and ready to assist you on your journey to long-term health. Thank you for watching, and we look forward to seeing you in our next video.